Good afternoon, everybody. It's Travis Bethel at AHI Health Home. Welcome to November office hours. I wanted to let you all know, as usual, we're recording this session and it will be posted on the AHI Training's webpage in the near future. And the slide deck will be going out to those after the meeting as well that are on the invitation list. So if you have any questions along the way or comments, please feel free to unmute yourselves or chat into the chat box, and we'll be happy to stop and talk and discuss. So we'll jump right in. Happy November. So we're going to touch on policy procedure as usual today, children's program updates. We're going to get into some net smart items. Health home consent we're going to talk about today. The health home referral and assignment process we're going to touch on. I'm going to do an update on core, the health home business intelligence plan, and also a plan of care training that we'll go over at the end of the deck today as well. So since our last meeting, we haven't had any new policies go out to the network, but I just wanted to pause and see if anybody had questions regarding any current policies and procedures that are out there. And also just to show what's going to be coming down the pike here, the children's waiver, HARP, quality assurance and performance and care transitions. So with that, does anybody have any questions around policy and procedure or any comments that they wanted to bring up? Okay. Well, as always, you can go to our policy and procedure page on the Health Home Care Management webpage, and it gives our most recent policies up to date on that for reference for folks. So next, we're going to slide into the HCBS audit results for year 2, and I was going to turn it over to Jessica for that. Jessica?
Hi, can you hear me?
Yes.
Okay, if I cut out, you got to take over.
All right.
So we received our formal audit results from the Department of Health last week. These are some targeted areas of improvement they've identified for our health home. They are pretty similar to what we discussed after we had our exit conference. The first area that they wanted to discuss was consents. And specifically, that is the freedom of choice form. In the records, they found that the freedom of choice form was present. However, it was not completed in its entirety. You have to make sure that you fill out all of the information and you check all of the boxes. With that, they were also looking for in the record that there was documented conversation with the families about their freedom of choice with providers. So we just need to work on making sure when we write our notes after we have done a level of care that we're noting that we reviewed this form with the family and that they selected the provider or providers after a discussion with the health home care manager. The second note would be level of care in and of itself. They found that we had 100%, our score was 100% for having our level of cares completed and completed on time and correctly. However, the record was lacking evidence that the families were involved in the actual level of care process. So much like when we have the conversations with our families when we complete our CANs, they would also like to see those same conversations happening with the families and then noted in our charts that we're doing that when completing our level of care as well. Secondly, after the level of care is completed, you are given an ineligible or eligible determination. And then either way, a notice of decision is issued to the family. In our records, they found the notice of decision form, but much like the freedom of choice form, they did not find evidence that that form was discussed and reviewed with the family. So they're looking through our notes to see if we're having those conversations with the family. And if a member happened to be ineligible, where they offered all of the options for being ineligible, such as their fair hearing rights. And then lastly, the level of care supporting documentation. So that would be the LPHA form, the diagnoses, and the functional limitations. All of those equal a level of care. And they found a lack of supporting documentation for that in the record. The third thing that was noted in our follow-up was plan of care. They were really looking for a comprehensive plan of care that included all of the needs from various assessments to be addressed in the plan of care. So that would be needs from the CANs, needs from your comprehensive assessment. If a parent, there was one chart noted where a parent had stated a specific need and that was not included in the plan of care. So they're really looking for us to tie that golden thread of documentation through all of our assessments and then have that roll up into our plan of care. Secondly, they really want us looking at the plan of care when a member's needs change. So if there is a significant event that occurs and the member's needs may change or the family's needs may change, they're really looking to have us update the plan of care to reflect that. Then the other thing noted with the plan of care is that we have to make sure that we're sharing the plan of care with the MCOs if they're enrolled in managed care. The only way to really do that in a audit record to demonstrate that that's what we're actually doing is to write a note right in the record that you have sent the plan of care over to the MCO. For services, again, just like an HCBS plan of care, you want to make sure that any service that you're sending a referral for is included in the plan of care. And then lastly would be safety planning. So updating the safety plan when a significant event has occurred. So either you update the safety plan right in NetSmart or you review the plan with the member and see if the plan is still applicable. And if so, making sure that you're writing a note that that safety plan was reviewed. You can go to the next slide, Travis. So we did have some strengths that they did note in our review. It wasn't all negative. They said that our health home care management activities are well documented in the record. So they do see good documentation of all of the core services that we're providing and all of the things that we're doing to support our families. Like I said earlier, LPHA forms are completed correctly 100% of the time. And then if you look at our results from year 1 to year 2, there have been significant improvements from our year 1 audit. So next steps from this will be updating our HCBS policies. So I'll be working on those and you'll see those come out. And secondly, we're going to be updating our HCBS waiver training. So I'm going to be updating that to reflect this feedback. And then once that is all set, I will be reaching out to each children's CMA to set up a time to do another HCBS training. And one thing to mention for year 2, they did not give us individual feedback on each chart. It was just a roll up of overall. So I don't know specifically for each CMA how each CMA did. It was just a general roll up of everybody. Does anyone have any questions?
Okay, Jessica, well, thanks for the overview. And
Thanks. I was worried I cut out there, but
no, just want to give people a chance to respond if they had anything. If anybody could think of anything they want to reach out through the chat or make a comment, or you can also reach out to the health home email, and we'll definitely get back to you. But thanks again, Jessica, for going through all those results for us.
Yep, no problem.
Okay, the next thing I wanted to touch on, I'm going to be doing an update to the care transitions policy in the near future, and I'm going to create a desk guide, and that'll be sent out to the network, and it's going to include the HCML hospital code. So you'll see here the screenshot. Courtney Palmer was able to get from HCML an updated list of the codes for hospitals that we interact with, and you'll see that on this particular screenshot here in the deck. So this will be inserted into a desk guide for folks for reference. And we hope it's helpful as you move forward, because as some are well aware, some of these codes, they don't necessarily, at least in my mind, logically link up to the actual facility that's listed. So it's nice to have that reference. So that'll be coming very shortly, but I want to give folks a heads up, and you have this deck that I'll send out after the meeting today as a quick reference in the meantime, if you're curious as to what code corresponds to facility. Then we're going to
Travis, I
transition.
just want to say thank you for getting those, because our care managers were really struggling with who to reach out to when they would get an alert that their patient was in the hospital to coordinate care. So we really appreciate the team getting this list.
Oh, thank you. Yeah, I give credit to Courtney Palmer. She's the one that tracked and chased it down. So thank you, Courtney.
Thanks,
And,
Courtney.
You're welcome.
But absolutely. And if we get any more updated information, we'll be sure to share that as well. But this should be helpful because it gets confusing for sure. Okay, for NetSmart, I wanted to touch on the HML billing questionnaire. We've had a handful of instances come up recently where members have been discharged, enrolled members have been discharged, and an HML wasn't completed for that month of discharge for that person. And we just want to reiterate that it's important that that's done because, as we all know, the HML is the link for our enrolled members so that we can get billed and we can bill and be paid for, when there's a core service provided. So just a reminder for that, we want to make sure folks are getting the ability to bill for that work that they're doing. But I do just want to know, once that person has been discharged, disenrolled, we've got to make sure that we're not trying to bill the month following, because that's not able to happen anymore, right? So that's the new provider that would be working with the person. So we got to stop trying to bill moving forward after that. And that's lined out in the disenrollment policy. But just a gentle reminder for folks so people can get their money. And then the other thing I wanted to talk about was health home consent, the 50-55. We've had some scenarios come up as well recently where MCO was not listed on 50-55. So we just want to encourage folks to do that. We do have interactions with MCOs requesting information. They do chart audit reviews, et cetera. And, it makes it difficult to get the information to them when there's not a consent for that information to happen. So we just encourage folks to do that and get them listed on the 50-55. Any questions so far before I go on to the health home referrals and assignments? Okay. Health home referrals and assignments. This is another reminder for folks. We just want to make sure that if you've got a person assigned to your organization, that you're making sure that you're having contact with that person within 7 days of that assignment. So that's lined out in our referral and assignments policy, and we just got to make sure that organizations are able to make that contact in that 7 days, the 7 calendar days actually. And if you're not, that's communicated to the health home so that we can either work with you or to work to get that person transferred to another organization who's able to take them on and have that response within the 7 days. And then the last piece is just the documentation piece. Please document those attempts in NetSmart so that it shows and that we can see the story, the path behind it. Because if it is a matter of not being able to link to the person, we want to be able to see that that's the case through the efforts that were put forth. Did anybody have questions or anything they want to talk about around the specifics of referrals and assignments? Okay, well, if you do, you know where we're at. Please reach out and we can work through it. Okay, so for core, CORE, OMH just recently announced, it was last Friday actually, I was on a call, and they had said that there's save the dates coming up Monday, December 13th, and then January the 24th of 2022. So the December 13th of 21 training is going to be specific to health home and health home care manager staff. And that training is going to go over the whole overview of what CORE is and what's behind the scenes with CORE, et cetera. So that 50,000 foot overview, if you will. And then on Monday, January 24th, there'll be an in-depth training for health home care managers. So OMH had announced that this save the dates. They're going to send this out through the MCTAC website link. If I happen to see it come out before others do, I'll make sure I send that out to the network. I did forward recently the HCBS provider training series, which is quote unquote specific to HCBS providers, but I'd like, just for transparency, folks, to see that, and if anybody's able to get on it still, if they want to learn about the different services, it'd be a great opportunity. But this save the dates here is specific to the nuts and bolts of what CORE is and how that process is going to work and how HARP factors in and how that's going to change or what types of changes come around that. So just put a hold, just a marker on your calendars, December 13th, January 24th. I provided here as well links to the actual MCTAC and CTAC webpage. It's like one and the same, if you will. You'll find on there at the bottom, if you scroll down on that link, that there's an ability to get on their listserv. So they'll send you those trainings and different announcements on trainings. So I encourage folks to do that if you haven't or it's something you're interested in doing. And then you'll get that fed to your emails. And I've also put here again the OMH CORE overview. So this is coming from the OMH webpage. And this is really, I laid it out, I think, last month during office hours. But this is really a nice flow of everything about CORE, and they're assimilated on that one page. The different policies around it, the different information that's coming around it, around the HCBS services, et cetera. So I urge folks to take a look at that as you're able to, so that you can get that information right from the source. Anybody have anything around CORE or questions? Anything that you wanted to talk about? Okay, well, hopefully these links are helpful for folks. And as I get information, I'll be sure to forward it as well. Data Den for our Health Home Business Intelligence Plan. We're continuing our soft rollout with the various organizations. We're finding that at this point is the effective path to take, because we continue to look at Data Den's functionality and looking at the data validity along that. So as we're working with each organization, we're also getting feedback from those organizations on what they think may be potential improvements for the platform as we go through the test environment. So for moving forward purpose at this point, we're going to have additional soft rollout, and we will announce further training as we get more into it here. But we just want to make sure we're doing it in a methodical, thoughtful way. We had gotten a lot of feedback originally early in the summer when we brought this particular website, this Power BI website up as a platform. Folks felt as though it was a lot at once. So we're trying to be mindful of that as we're bringing it forward through a soft rollout. As folks have questions, please ask, and we'll do everything we can to walk you through it and take the feedback and improve the platform. Anything around the Data Den? All righty. Well, long-awaited plan of care training. So Jessica Robertson and I actually had put this together in July of this year, and we had to go through a time frame where we're waiting for it to get snipped and trimmed and put on the website, et cetera. So now we've arrived. We're there. So on our Health Home Trainings webpage, if you're to go on there, the links here, you're going to find a plan of care training adults and children section. It's underneath the office hours section. We've broken it out to 6 different modules, as you see here on the slide. We tried to be thoughtful on how we broke the training out, and we wanted it to be a quick reference for folks as well, so that you're not scouring through one recording. You can get right to where you want to go. So module 1 is care plan theory. Module 2 is assessments for care planning. Developing a plan of care is module 3. Goals is module 4. Module 5 is objectives and notes, and module 6 is amending the plan of care. So we really wanted to be thoughtful again about how we did this training. We thought this was the best way to put it out there for folks. The theory behind how we came to developing this, the philosophies of how we'd like to see, our network transition toward writing plans of care and developing goals. So you're going to see a lot of information in there. Please reach out if you have questions. We're always open to suggestions and feedback. But I know folks have been waiting for this for a while and been asking and been patient. So thank you very much. But we're happy that it's finally up and live for folks. So I think the longest module was roughly half an hour. So they're not overly long modules. Most of them are right around that 20-minute, 15-minute time frame. A couple are closer to the half an hour mark. So it's not overbearing in that sense. So hopefully it's beneficial for folks. So any questions, please reach out. And that is the plan of care training for adults and children. So health home staff. And then I wanted to say happy holidays to folks. I know we have Thanksgiving coming up in a couple of days. So happy Thanksgiving to those of you that are going to celebrate. If you're not, enjoy your time off, or both, enjoy both. But this is our last scheduled office hours for 2021, which is hard to believe. We're already pushed to the end of the year. So I wanted to take the time now to wish folks a happy holidays. That's not to say that if we don't have something pertinent come up that we wouldn't pull a session together if we needed to prior to year end. But currently there's no more scheduled for this year. But thank you all for everything you've done over this past year, as always. And, again, it's been another trying year, with COVID. And, just want people to continue to be safe and thoughtful about their interactions when they're out there doing the great work that you do every day for you and your teams. Before we end, I just wanted to ask if anybody had any questions or wanted to talk about anything. But thank you so much for everything you all do. And I'll open it up if anybody has any questions or anything they want to talk about. All right, going once, going twice. Have a great afternoon, everyone. Happy holidays. Take care.
Bye, everyone. Happy holidays.
Happy holidays.
Thank you. Happy holidays, everybody.
Happy Thanksgiving. Bye-bye.